Hello, my name is Helene Markham-Jones and I'm a Research Associate at the Lincoln International Institute for Rural Health, which is situated in the new Lincoln Medical School at the University of Lincoln. My career pathway to date has been somewhat eclectic, with many years working in business and industry in operational, project management and business analyst roles across public and private sector organisations. Professional and research roles in the fields of art, science and technology, commerce and healthcare have provided me with a prismatic and broad perspective of the ranging values and contributions of human enterprise, endeavour and experience, and the benefits of transdisciplinary practice within research and innovation. Working within business and operations has given me the human-centric focus that is relevant to organisational systems as well as human healthcare research. Having worked in clinical research organisations like PARXL and the NHS, I became particularly interested in investigating healthcare operations, clinical trial methodologies, meta-governance and associated social and cultural challenges existing within healthcare organisations and patient populations. Health, work-related and population inequalities have also become an important part of my research. My academic research interests encompass operational research, complexity science and design thinking, which are aligned to thematic research areas of knowledge exchange, transdisciplinarity and implementation science. Working at the Lincoln International Institute of Rural Health, I now have the opportunity to join colleagues in undertaking important research addressing health and well-being challenges of coastal and rural populations through inclusive and transdisciplinary approaches and practice. One of the Institute's goals is to design, build and evaluate innovative and sustainable rural and coastal models of care. A particular area of research that I'm seeking to develop and implement is a design model called a Prismatic Coherence Model, PCM, which is an analytical tool for modelling human systems. This can be applied to healthcare contexts as well as complex organisational systems and networks. The shared values in human systems model is built around 6 core conceptual elements, which can be used to evaluate existing systems and processes or the design of new ones. These 6 pillars of a human system are sensitivity, synchronicity, sustainability, as well as being salutogenic, scientific and serendipitous. The PCM model was an outcome of my doctoral research, which was a project entitled EFACCT, an evaluation of follow-up and complexity in cancer clinical trials, and was a national multi-centre study run at 13 NHS clinical trial units across England and Scotland. This led to the publication of my thesis entitled Being Human, a grounded theory of complexity and serendipity in cancer clinical trials. What this research revealed, and has particularly resonated with me, is that no matter what field of clinical or public health research you are in and working within, that a humanist sensibility should be central to understanding health and disease states and the processes and systems of healthcare that we design to respond and manage these. The importance of understanding human perspectives within the context of healthcare systems and organisations introduce the concept of ergonomics, which is a discipline that is aligned with operational evaluation but seeks to optimise human well-being as well as overall system efficacy and performance. Human responses to the multiplicity of illness-wellness states are highly sensitive to environmental conditions and are imbued with contextual meaning. Research in this field highlights the importance of place-based approaches and understanding of interpersonal relationships and their impact in practical and operational terms, and also on human physicality and emotional sensibilities. Research within areas of operational research and implementation science can provide important insights into contextualised challenges across wide-ranging and niche subject areas, which can inform policy and practice in clinical and public health. Personally, I'm interested in advancing research in the field of human factors and ergonomics, or HFE, within and across organisations, be they public or private bodies, to develop creative, sustainable and human-centred models of practice which have the capacity and capability to manage the growing complexities and burdens of healthcare, whether that be applied locally, regionally or internationally. I hope that this short video has been useful. If you'd like to know more, please visit our website where you can find updates on the different research activities of the team at the Lincoln International Institute for Rural Health.